Hello friends, let us now learn some important one points about each of these disorders. So these are the different disorders, okay, which you have to identify. So first, here if you see, there is no brain completely. You cannot see the cerebral hemispheres completely. So this disorder is given the name of hydrancephaly. Hydrancephaly is a disorder where there is absence of cerebral hemispheres and whole cerebral hemispheres are filled with fluid filled sac, are replaced with fluid filled sac. In this you will see the transillumination test to be positive. And this is the next disorder where there is herniated cerebellum are seen. So this is Arnold-Chiari malformation. What is this? This is Arnold-Chiari malformation where you see herniation of cerebellum. Okay, there are types of Arnold-Chiari malformation. We will learn in a minute. And here this, if you see, this malformation is, here there is dilated fourth ventricle and you are not seeing cerebellum. See, here there is cerebellum, but that cerebellum is almost, you cannot see it, right? It is over here but not completely visible. So in here there is this is Dandy-Walker malformation, where this is Dandy-Walker malformation or Dandy-Walker syndrome, where there is dilated fourth ventricle and also cerebellar vermis hypoplasia. Then this is the next disorder where you see that there is a vessel which is dilated, right? So this here you can see this dilated vessel. This is called as vein of Galen malformation. What is this vein of Galen malformation? The vessel involved in this vein of Galen malformation is median prosencephalic vein of Markowski. Median prosencephalic vein of Markowski. If there is any problem in this median prosencephalic vein of Markowski, this will result in vein of Galen malformation. Okay, this occurs at 11 to 13 weeks of gestation. Okay, so now after this we will see some important points about the only one malformation which should be dealt in detail, that is Arnold-Chiari malformation. In this Arnold-Chiari malformation, as I have said, here there is herniation of cerebellum into the foramen magnum. This is of two types. One, it is not associated with hydrocephalus. Second, it is associated with hydrocephalus. Okay, these are the two types of Arnold-Chiari malformation. If it is not associated with hydrocephalus, this is seen in adolescent age groups. It is seen in adolescent age group and presents with headache and urinary problems. Whereas second type, it is associated with hydrocephalus and also myelomeningocele. Because of its complex conditions, it is presented early, that is in childhood itself. So these are the two types of Arnold-Chiari malformations. Thank you for watching.